I'm Mrs. Princey, Associate Professor in Mental Health Nursing. The first line of treatment that is most commonly used to treat a psychiatric condition is the psychopharmacology. So today I'm going to talk about the major psychotropic drugs which are used to treat the psychotic conditions. So let me tell you the topic for the day. It is about the antipsychotic drugs. Antipsychotic drugs are a group of drugs which are used to control the psychosis, which is the ability to perceive and interpret the reality accurately, think clearly, respond correctly, and function in a socially acceptable manner. So these are the group of drugs which are used to treat the psychotic conditions. Antipsychotic drugs are the otherwise called as the neuroleptic drugs. Why they are called as neuroleptic drugs? Because these antipsychotic drugs, when the client is taking, it will cause some neurological, side effects. And other names for these antipsychotic drugs are otherwise called as major tranquilizers or D2 receptors blockers, or otherwise it is the anti-schizophrenic drugs. Let us see the classification of the antipsychotic drugs. Antipsychotic drugs are mainly classified into two categories. One is the typical or the classical antipsychotics, and number two is the atypical or the novel antipsychotics. Let us see the further classification of these categories. The first one, which is the typical or the classical antipsychotic drugs, are being further classified as phenothiazines. Phenothiazine group of drugs, which includes aliphatics, which includes the examples of chlorpromazine and triflupromazine. The second phenothiazine group of drugs is the piperidines. Example, mesoridazine and thioridazine. The third one is piperazine. Example, flufenazine, chlorproperazine and trifluperazine. That was about the phenothiazines. The next subclassification of the classical antipsychotics is thioxanthine group of drugs, which includes again the aliphatics, example chlorprothiazine. The second one is piperazine, example flufenthioxole and thiothiazine. The third subcategory are the butyrothiones. Example, haloperidol and trifluperidol. The next one is the diphenylbutyl piperidines, which includes the example of penfluridol and pimozid. The next one is the indole derivatives, which includes the example of molindol. The next one is dibenzodiazepines, which includes the example of loxapine. So that was about the typical antipsychotic classification. Moving on to the second category of classification, which is the atypical, otherwise called as novel antipsychotics. The first classification under this is the dibenzodiazepine, which includes the example of the drug clozapine. The second one is substituted benzamides, example amisulpride and sulpride. The third one is the benzoxyls, which includes the examples of hoperidol, paliperidol and risperidone. Benzisothiazole, example ziprasidone. The next one is thenobenzodiazepine, which includes the example of olanzapine. The next one is dibenzodiazepine, example quetiapine. The next one is the partial agonist, which includes the drugs aripiprazole, bifepronox. The next one is the dibenzodiazepine, example zotipine. The next one is dibenzodiazepinoperone, example asinapine. So these are the drugs which comes under the atypical or the novel antipsychotics. This is the major classification of the antipsychotic drugs. So moving on to the mode of action. So when the patient is on this antipsychotic group of drugs, so how is this acting in the body? We'll see the mode of action. So the mode of action, the exact mechanism is unknown. But we have got a theory that the typical antipsychotics works by blocking the postsynaptic receptors, which is present in the basal ganglia, the hypothalamus, limbic system, brain stem, as well as the medulla. So this is the mechanism of action of the typical antipsychotic. Moving on to the mode of action of the atypical or the newer or the novel antipsychotics. These act by blocking the action of receptors which are very specific to certain neurotransmitters like the dopamine, serotonin, and the other neurotransmitters. So you know very well, in case of schizophrenic condition, the level of dopamine is increased. So that is one of the changes which happens in schizophrenia, increased level of dopamine, right? So these drugs will act on these receptor sites specifically, which is related to the dopamine and serotonin as well as other neurotransmitters. So that was the mode of action. Moving on to the indications of these antipsychotic drugs. So especially these antipsychotic drugs are given in the organic brain psychotic conditions, which includes the delirium, dementia, delirium tremens, and drug-induced psychosis. So if you take the functional psychotic conditions, example, we have a list of these disorders wherein the antipsychotic drugs are prescribed. So number one, we have got the schizophrenic conditions, schizoaffective disorders, acute psychosis, mania, as well as the major depression. It can also be given in the cases of hypochondriasis. The next one, the indications we have in the childhood disorders. So in the childhood, what are these conditions where this antipsychotic group of drugs can be administered? Number one, it is given in the ADHD, attention deficit hyperactivity disorder, childhood autism, enuresis, as well as the conduct disorders. Moving on to the next disorders, the neurotic disorders. In the neurotic disorders, these antipsychotics can be prescribed in the conditions of anxiety, obsessive compulsive disorder, that is the OCD. It can be prescribed in anorexia nervosa as well as certain conversion disorders. There are some medical conditions where they may show the psychotic features. So in those cases, these antipsychotic group of drugs are administered. So for example, we have the conditions like migraine, nausea and vomiting, hiccups, heat stroke, Huntington's chorea, tic disorders, as well as severe pain disorders. So these are the indications of the antipsychotic group of drugs. So moving on to the pharmacokinetics. So when the drug is taken, how is the drug working on the body? So pharmacokinetics of the antipsychotic group of drugs. When the drug is taken orally, the drug is absorbed by the GI tract and distributed unevenly in the blood. It is highly bound to the plasma protein as well as the tissue proteins. The brain concentration of the antipsychotics is higher compared to the plasma concentration. It is metabolized in the liver and is excreted through the kidneys. The action of the drug lasts for about 6 to 8 hours, and the plasma half-life of the drug, that is the time taken by the drug to get completely excreted out of the body, is about 18 to 30 hours. So you can imagine for how long the drug, the concentration of the drug in the blood will remain. Okay, so that is the half-life of the drug, which is about 18 to 30 hours. Moving on to the adverse effects and the nursing management of these adverse effects. So when the patient is on the antipsychotic group of drugs, okay, so there are various adverse effects that the patients can experience. Very important, the nurse's role when she is administered these kind of the antipsychotics to monitor for the adverse effect and also manage it. Okay, number one adverse effect is the anticholinergic effects, which includes the first problem of dry mouth. So when the patient is having the dry mouth, see to it that oral hygiene is frequently taken care of. Give him the sips of water, sugarless candies, or ice cubes can be given to quench this thirst or the dry mouth. The next problem which the client will experience is the blurred vision. So always reassure the client that there may be chances of the blurred vision. which will subside after a few weeks. And also instruct him not to drive the vehicles because there may be chances of the accidents due to the blurred vision. Right. So the next anticholinergic effect which is seen is the constipation. So when the client has this problem of the constipation, see to it that you encourage the client to include the high fiber diet, and also encourage him to do some physical activity and also take ample of water if not contraindicated in certain conditions. The next one is the urinary retention. So urinary retention can also be a problem wherein you instruct the client that there may be chances of the urinary retention. So if you have that problem, to kindly intimate or bring to the notice of the staff so that they can do the needful, and also maintain the strict IO chart because the client is having the urinary retention. So that was the first adverse effect, which is the anticholinergic effects, which includes the dry mouth, blurred vision, the constipation, as well as the urinary retention. Moving to the second adverse effect, which is the nausea or the GI upset. So when the client is on the antipsychotic group of drugs, there may be chances that the client may have gastric irritation or feeling of nausea or vomiting. Okay, always instruct the client to take the drug with the food to avoid the gastric irritation, and to avoid taking the antacids, because when these antacids are taken, it will decrease the absorption of the antipsychotic group of drugs. So always instruct the client not to take the antacid group of drugs just because it is causing the GI upset, but rather encourage the client to take the drug with the food to avoid this GI problems. The next adverse effect is the skin rash. So always encourage the client to report if there are any changes on the skin or the rashes, that allergy reactions that the client will experience, and also educate him to avoid the spilling of liquids onto the skin, because first of all the client is having the more chances for the skin irritation or the dermatitis. So the liquid, when it falls, there may be chances of more irritation. So always educate them to avoid the spilling of liquids onto their skin. The next adverse effect is the sedation. So most of these psychotropic drugs, there may be side effect or the adverse effect of sedation. Always educate the client if he is feeling sedated for a long period of time that he is not able to control, to bring it to the notice of the psychiatrist so that he can bring about a change in the drug, or he can bring about a change in the dosage of the drug, or he can prescribe the drug which is causing him to be sedated at the bedtime, which will also make him to relax, right? So these are the things that you have to educate the client if he is having the sedative effect. Another important thing that you have to educate the client is not to drive the vehicles or use the equipments, because there may be chances of accidental injury. So sedative effect can cause accidental injury, so educate them not to use such equipments or work on the machines. The next side effect or the adverse effect is the orthostatic hypotension. So frequently you see to it that at every shift you monitor the blood pressure of the patient, and also educate the client to not rise immediately from a lying down position, right? So educate him to slowly rise up from a lying down position, sit down on the bed for some period of time, and only then he has to rise because of the risk of the orthostatic hypotension. If there are changes in the blood pressure, do report it to the psychiatrist. So these are the management of the orthostatic hypotension. The next adverse effect is the photosensitivity. So very much important. The client becomes very sensitive to the rays of the sun. So always educate him to apply the sunscreen on his body, use the goggles or the hat or protective clothing so that he may not have the irritation or the photosensitivity. The next adverse effect is the hormonal effects, or the changes which happens in the hormone can result in decreased libido. So decreased libido can be there, can cause a retrograde ejaculation in case of male patients. It can also cause the gynecomastia. So you can always reassure the client before starting the therapy that these changes or the effects can be seen, and once the patient completes a particular treatment, these things can be reversible. So that is what related to the decreased libido. The next thing is the amenorrhea. If you take the female patients, especially they may have a changes in the menstrual cycle. So educate them to use the contraceptive pills, because amenorrhea doesn't mean that the ovulation is stopped, right? So educate them to use the safe precautions to avoid the unwanted pregnancies. The next hormonal effect is the weight gain. Most of the clients, they see to it that the weight is being monitored every other day, and diet which is restricted in the calorie is being given to the client. Provide the opportunities to practice the various activities or the exercises for the client to manage the weight gain. The next adverse effect is reduction in the seizure threshold. Especially when the client is on this drug clozapine, there is chances of 1 to 5% of the client who develop the seizure. So always monitor and observe for the seizure threshold, and also monitor if the client is having any history of the seizure. So especially before administering this drug clozapine. The next adverse effect is the agranulocytosis. Especially when the client is on this drug clozapine, there is chances of 1 to 2 percentage of the clients who develop this agranulocytosis during the first 3 months of the treatment, initiating the treatment. So always see to it that the WBC counts are monitored, because if it is identified in the earlier stages, the condition can be treated, right? Observe for the symptoms of sore throat or malaise or fever. These indicates that the patient has developed the infections. So always monitor the WBC count, the granulocytes count. If it is falling below 3000 cubic millimeter, or the granulocytes count for the 1500 cubic millimeter, immediately stop this clozapine therapy and intimate the same to the psychiatrist. If you identify the agranulocytosis in the earlier stages itself, the cure can be given. The next adverse effect is the salivation. Okay, salorrhea. This is another important adverse effect related to the drug clozapine. So when the patient is on the drug clozapine, there is an increased chance of salivation or salorrhea. So always provide a reassurance to the client, because it's an embarrassing situation to the client. So once the therapy has been completed, the reversibility happens by itself. So always give a reassurance to the client. The next adverse effect of the antipsychotic is the major adverse effects, very important, which is the extrapyramidal symptoms. These are the very important adverse effect of the antipsychotics, which is termed as the EPS, wherein you have to observe and monitor for these symptoms which will develop in the client, right? So the major treatment or the management for the extrapyramidal symptoms is the administration of the anti-Parkinsonian drugs. So when I say the extrapyramidal symptoms or the EPS, we have got a list of the symptoms which are there. So number one, which includes the pseudo-Parkinsonian symptoms. So wherein the patient will experiences the symptoms of tremor, shuffling gait, drooling, as well as rigidity. These symptoms usually appear by 1 to 5th day of starting the therapy on the antipsychotic drugs. These pseudo-Parkinsonian symptoms especially is seen in the women, elderly, as well as the dehydrated clients. The next extrapyramidal symptom is the akinesia, wherein the patient will have the muscular weakness. So the symptoms which are experienced are rigidity and trembling of head, rigidity and trembling of the extremities, forward tilt of the trunk, reduced arm swinging, and shuffling gait with short steps. So these are the symptoms which can be seen in the akinesia or muscle weakness. The next extrapyramidal symptom is the akathisia, It is nothing but the continuous restlessness and fidgeting. This kind of a symptom is usually seen in the women, and after about 50 to 60 days of initiation with the antipsychotic group of drugs. The next adverse effect, that is the EPS symptom, is the dystonia, wherein the client will have the involuntary muscle movements or the spasms. Especially the areas involved in the spasms are the arms, legs, face, as well as the neck. This dystonia usually occurs mostly in the men, and the age group is younger than 25 years old. The next extrapyramidal symptom is the oculogyric crisis. So, oculogyric crisis is nothing but the uncontrolled rolling of the eyeballs. This usually may be mistaken as a seizure activity, but closely monitor if the client is having this rolling back of the eyes, which is the oculogyric crisis when the client is on the antipsychotic drugs. It's an emergency situation, the dystonia as well as oculogyric crisis, so the physician or the psychiatrist to be contacted immediately may start the client on the drug, which is the benztropine. Another very important the nursing role is you have to sit with the client and make sure that you give the reassurance to the client and calm down the client, since the patient becomes very anxious and fearful when he is experiencing such spasms on the rolling of the eyeballs. The next extrapyramidal symptom is the tardive dyskinesia. So what is this tardive dyskinesia? The patient will have the desired facial movements or the tongue movements, we can say. He'll have difficulty in swallowing and also the stiff neck. All the clients who are receiving the antipsychotic drugs for a longer period of time, as a long term duration can be months or years, will experience this kind of a symptom, which is the tardive. The symptoms are irreversible, so closely monitor if the patient will have these abnormal or bizarre movements of these face and the tongue. The first thing that you need to do is, when you identify the patient is having these vermiform movements of the mouth and the tongue. So it's not the vermiform movements is nothing but you would have seen how a rabbit is moving its the mouth when he eats something. So right, so how rapidly there is a movement of the mouth or the tongue. So similar movements that you can notice in the client who are receiving the antipsychotic drugs for a longer period of time. So vermiform movements should be identified so that immediately you can stop this drug, prevent the irreversibility. So that is the major nurse's responsibility, to monitor if the patient develops this tardive dyskinesia. The next EPS symptom is the neuroleptic malignant syndrome. It is a very rare side effect, but if it is seen, it can be a fatal one. So routinely do the assessment for the temperature and also observe for the development of the Parkinsonian symptoms in the patients. The onset of the symptom usually is rapid within 24 hours, or even the years these symptoms can develop, and the progression can happen between 24 to 72 hours. Since this neuroleptic malignant syndrome is one of the fatal conditions where it's an emergency condition, you have to identify if the patient develops these symptoms, especially which is related to the Parkinson's, like the muscle rigidity or the hyperpyrexia, which can range up to 107 Fahrenheit. Patient may develop the tachycardia, tachypnea, changes in the ECGs, fluctuations in the blood pressure, diaphoresis, and rapid changes in the mental functions can range from stupor to coma. So always be vigilant as a nurse to monitor if the patient develops these neuroleptic malignant symptoms, which is again very much life threatening. If you notice these symptoms, immediately discontinue the antipsychotic drug. And also, you have to monitor the vital signs, muscle rigidity, intake output, and also assess for the level of the conscious of the patient. So that is the management for the neuroleptic malignant symptoms. Other things that you can do is inform the physician so that he can order some drugs like dantrolene or the bromocriptine drugs, which are used to treat the Parkinsonian condition. So these are the adverse effect which is seen as the extrapyramidal symptoms, the major adverse effects of the antipsychotic drugs. Okay, so if you take the overall adverse effects of the antipsychotic drugs, we have the anticholinergic adverse effects, GI or nausea symptoms we have got. Apart from that, we have got the major, sedative effects or orthostatic hypotension. Then we have got the extrapyramidal symptoms, right? So moving on to the nurse's responsibility when the patient is on the antipsychotic drugs. So the first responsibility is when the patient is on the antipsychotic drugs, always monitor the client, observe the client for the adverse effects and also for the complications to identify and to report to the psychiatrist immediately. Look and observe for the extrapyramidal symptoms, okay, which includes the neuroleptic malignant syndrome, Parkinsonian symptoms, the tardive dyskinesia or dystonia, akathisia, kinesia, all these symptoms that you have to monitor if the patient develops. Observe for the drowsiness or the sedative effect. So see to it that a drug which is causing the sedation should be administered at the bedtime, or if the sedation is too much for a long period of time, you communicate it to the psychiatrist so that he can bring down the dose or make some modification in the drug. Observe if the patient develops any kind of a sore throat, fever, or malaise, okay, which indicates the patient has already developed the infection because of agranulocytosis. So very much important when the person is on the drug close-up, and you need to monitor WBC counts and granulocytes count so that you can prevent these infections in the client. Monitor for the blood pressure. If the BP falls below 20 or 30 mmHg, the intervention should be done immediately. Another important thing, the patient often they feel very thirsty, or they have this dry mouth. So educate the client to have these frequent sips of water, have some chewing gums or lemon in the mouth or ice cubes, so that it will prevent this. So that will prevent the dry mouth. Another important thing is the blurred vision or the impaired vision can happen because of the pigmented retinopathy. When the patient is on these antipsychotic drugs, always reassure the client and, if possible, inform him that there may be a chances of becoming blind, right? So give him the reassurance, the education about it, and see to it that you also educate related to avoid the driving or use of equipments or machines when he is on the antipsychotic drugs. Another important thing we have is the weight gain. So always see to it that you monitor the weight, to give the education related to the physical activity as well as the diet. When the patient complains about the gastric irritation, also educate him not to take any kind of antacid drugs because it can have reduce in the effect of the antipsychotic agent. So you can educate him to take the pills with his food. If the patient is having associated prostate hypertrophy, so see to it that there is a restriction of fluid intake of at least 2500 ml of intake that can be taken, and also maintain the intake output chart. If the patient is having the chances of this skin allergies, yes, you also educate them to avoid this photosensitivity by using the sunscreen lotions or use of goggles or the clothings which will reduce the irritation onto the skin. And in case of female patients, there are chances of the menstrual changes which can happen, amenorrhea. Educate them to use the contraceptive pills to avoid getting pregnant. Okay, so that is about the nurse's responsibility when the client is on the antipsychotic drug. So moving on to the patient education. Right? What is the education that you give to the patient and the family as a nurse? One of the important education that you will be giving for the client and the family is about the drug therapy, proper adherence to the drug therapy or compliance with drug therapy. Educate them not to stop the drug, okay, without intimation to the psychiatrist. Okay, always if they want to have any problem related to the drug, it has to be brought to the notice of a psychiatrist so that he can bring about the modification in the dose it can be, or stop the drug, right? Or because these drugs, especially the psychiatric drugs, when it is stopped rapidly, right, it will cause these side effects, or it will cause nausea or seizure in the client. So always see to it that you give education to the client and family not to have any alteration in the dosage or not to stop the drug immediately. Educate the female clients that there may be changes in the menstrual cycle and to take the precautions, and these changes can be reversible. Another important thing is you have to give reassurance to the relatives that the medication therapy will take time to work on the patients to become active. So very, very important education, since the relatives are the one who will be taking care of the client, so they'll be the one who will be giving the medications to the client. They'll be observing the changes in the improvement when the drug is given. So they will be very much anxious if there is no improvement within a week or within 2 weeks of taking the medication. So unlike the medical conditions, any medical conditions, you can see that there are changes or improvement in the symptoms when the patient starts with the therapy. But the psychiatric conditions, it takes time for the drug to actually act. So usually the after initiation of the pills or taking the psychopharmacological drugs, so usually the action can be seen after 15 days of starting the medication. So educate them not to hurry and not to come to a conclusion that the drug is not working on the patient. So within few weeks of initiating the treatment, only the action of the drug will actually take place in the body and they can see the changes later on. But not to become very anxious that it is not helping the client. Okay, so always give this education to the relatives. Another important thing that you will be educating the patient that there may be chances of dizziness, there may be chance of injury because of these kinds of medications. What is taking the injections? It can be because of the orthostatic hypotension. So always educate them to be aware of these conditions. Apart from this, the same things that you will be educating the client related to the weight gain, to monitor the weight gain, to have a planned calorie diet, okay, then to have a physical activity or exercise to be done, monitor the intake output chart, encourage the frequent mouthwash to the client to prevent the dryness of the mouth. Avoid the exposure to the sunlight because of the risk of developing the skin rashes or dermatitis. So these are the educations that you will be giving to the patient as well as the family members. Okay, so very important when you learn about the antipsychotic groups of drugs, the classification, the how's this drug acting, okay, what is the adverse effect of this drug, especially the extrapyramidal symptoms, how to monitor and manage those symptoms, what is the education from the nurse that you are going to give, and the nurse's responsibility becomes very, very important when the client is on the antipsychotic therapy. Hope you all have understood the topic. Thank you.